we just did, I'd like to explore diabetes in more detail. What is actually diabetes? Diabetes is a condition that happens when your blood sugar glucose is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Diabetes affects people of all ages. Most forms of diabetes are chronic and all forms are manageable with medications and lifestyle changes. Glucose mainly comes from carbohydrates in your food and drinks. It's your body's go-to source of energy. Your blood carries glucose to all your body cells to use for energy. When glucose is in your bloodstream, it needs help, a key to reach its final destination. This key is insulin, a hormone. If your pancreas isn't making enough insulin or your body isn't using it properly, glucose builds up in your bloodstream, causing high blood sugar, which is hyperglycemia. Over time, having consistently high blood glucose can cause health problems such as heart disease, nerve damage, and eye issues.
There's 3 types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. In Malaysia, type 1 diabetes is quite rare, accounting for less than 1% of all diabetes cases. Type 1 diabetes is thought to be caused by an autoimmune reaction. This reaction stops your body from making insulin. If you have type 1 diabetes, you'll need to take insulin every day to survive. Currently, no one knows how to prevent type 1 diabetes. Type 1 diabetes is usually diagnosed in children and young adults, but can be diagnosed at any age. Next, type 2 diabetes. In Malaysia, diabetes is a significant health concern, with type 2 diabetes being the most prevalent form. According to the National Diabetes Registry Report 2023, about 99.48% of diabetes cases in the country are type 2 diabetes. With type 2 diabetes, your body doesn't use insulin well and can't keep blood sugar at normal levels. It develops over many years and is usually diagnosed in adults, but more and more in children, teens, and young adults. Lastly, gestational diabetes, which is for pregnant women. Gestational diabetes has a significant prevalence, affecting around 23.2% of pregnancies. During pregnancy, your body makes more hormones and goes through other changes such as weight gain. These changes cause your body cells to use insulin less well, which is a condition called insulin resistance. Insulin resistance increases your body need for insulin. On the other hand, you are at higher risk for gestational diabetes if you had gestational diabetes during a previous pregnancy and if you are overweight. And lastly, if you have a hormone disorder called polycystic ovary syndrome.
Diabetes doesn't just appear out of nowhere. There are several symptoms that may indicate someone has it. One major symptom is frequent urination, which happens because the body is trying to get rid of excess sugar in the blood. And of course, when you lose a lot of fluid, you will become extremely thirsty. That is why excessive thirst is another common symptom. People with diabetes may also experience unexplained weight loss even if you are eating normally, constant hunger, and fatigue because their body isn't using glucose properly for energy. Other signs include blurred vision, slow healing wound, and tingling in the hand and feet due to nerve damage. There are 2 types of diabetes with different causes. Type 1 diabetes is an autoimmune disease where the immune system attacks insulin-producing cells in the pancreas. Without insulin, blood sugar level become unregulated. While the exact causes is unknown, genetic factor and viral infection are believed to play a role. Type 2 diabetes, which is more common, is mainly caused by insulin resistance, where the body no longer responds properly to insulin, leading to high blood sugar. This is often linked to obesity, especially excess abdominal fat, poor diet, and lack of exercise. Genetics also contribute, meaning if you have a family history of diabetes, your risk is higher. However, if you are adopting to healthy lifestyle, you can lower the chances of getting this disease.
Diabetes could lead to 2 complications, which is long-term and also acute diabetes complication. Firstly, we dive deep into acute diabetes complications. Acute diabetes complications that can be life-threatening include hyperosmolar hyperglycemic state, HHC, HHS. This complication mainly affects people with type 2 diabetes and happens when your blood sugar levels are very high for a long period of time, leading to severe dehydration and confusion. Secondly, diabetes-related ketoacidosis, DKA. This complication mainly affects people with type 1 diabetes or undiagnosed type 1 diabetes. DKA happens when your body does not have enough insulin. If your body does not have enough insulin, it can't use glucose for energy, so it breaks down fat instead. This process eventually releases substances called ketones, which turn your blood acidic. This could cause labored breathing, vomiting, and loss of consciousness, which calls for immediate medical treatment. Thirdly, severe low blood sugar, hypoglycemia. Hypoglycemia happens when your blood sugar levels drop below the range that is healthy for you. Severe hypoglycemia is very low blood sugar, mainly affects people with diabetes who use insulin. Signs include blurred or double vision, clumsiness, disorientation, and seizures. It requires treatment with emergency glucagon and also medical intervention. Next, let's look through long-term diabetes complication. Cardiovascular issues are the most common type of long-term diabetes complication, which include coronary artery disease, heart attack, stroke, and atherosclerosis. Other than cardiovascular issues, another diabetes complication include nerve damage, which cause numbness, tingling, and pain. Nephropathy, which can lead to kidney failure or the need of dialysis or transplant. Retinopathy, which can lead to blindness. Diabetes-related food condition, skin infections, amputations, hearing loss, and oral health issues such as gum disease. Furthermore, living with diabetes can also affect your mental health. People with diabetes are 2 to 3 times more likely to have depressions than people without diabetes. That is why it is important for us to take prevention before diabetes take over our health. Healthcare providers diagnose diabetes by checking your glucose level in a blood test. 3 tests that can measure your blood glucose level include fasting blood glucose test. For this test, you don't eat or drink anything except water for at least 8 hours before the test. As food can greatly affect blood sugar, this test allows your provider to see your baseline blood sugar. Secondly, random blood glucose test. Random means that you can get this test at any time regardless of if you have fasted. And lastly, A1C. This test, also called HbA1c or glycated hemoglobin test, provides your average blood glucose level over the past 2 to 3 months. In addition to screen for and diagnose gestational diabetes, providers order an oral glucose tolerance test. All of these tests that I have mentioned typically indicate whether you have diabetes, don't have diabetes, or pre-diabetes. These values could vary, and that's why healthcare providers choose more than one test to diagnose diabetes.
There are a few diabetes treatments. First is insulin. Insulin helps you manage your blood sugar levels and helps prevent diabetes complications. Next, we have metformin. Metformin is a drug that can be used on its own to lower blood sugar levels, or it can be taken with other diabetes medications, including insulin. Metformin works by reducing the amount of glucose that the liver releases into your body, and it helps insulin your body makes work better. We also have diabetes tablets and medications such as weight loss medications and SGLT2 inhibitors, which all work in different ways. Diabetes patients can also manage diabetes by eating a healthy, balanced diet and exercise regularly. Next, we have technology. There are lots of different types of diabetes tech like insulin pumps and continuous glucose monitor. Other than that, there are other treatments which are type 2 diabetes remission, weight loss surgery, known as bariatric surgery, and immunotherapy. Immunotherapy is a new treatment that reprograms the immune system so that it no longer attacks and destroys insulin-producing cells in the pancreas.
You are probably wondering about how we can prevent diabetes. You can actually prevent autoimmune and genetic forms of diabetes, but there are some steps you can take to lower your risk for developing prediabetes, type 2 diabetes, and gestational diabetes, including eat a healthy diet such as the Mediterranean diet, get physically active, aim for 30 minutes a day at least 5 days a week, work to achieve a weight that's healthy for you, and also manage your stress. It's also important to note that there are some diabetes risk factors you can change, such as your genetics or family history, age, and race. Note that type 2 diabetes is a complex condition that involves many contributing factors.